Hello! Today we are walking through the arteries of the lower limb. That's right, every single one. We're going to make connections and see the relationship between the lower limb and the arteries that supply it. Remember, I always link in the description to the outlines that are available to you that I have drawn for you that you can then download onto a piece of paper or onto your iPad and you can draw on top of, so you don't have to draw everything. We can speed up this process. So you can follow along while we go, but we're going to jump right into it, and I apologize in advance. I am incredibly sick when I recorded this video, so you're going to hear a lot of cuts and stuff like that because I was coughing. Okay, let's get into it. Hey everybody, it's been a hot minute. I have a cold right now, so there's going to be a lot of editing. I got a request, so I'm making this video for you today as a follow-up to the nerves video where we walked through all of the lower limb and we went through all the nerves and all their pathways. That video is available to you already. I'll link it here, and I'm going to struggle through it. All right, so to orient you, I have some things already drawn. This is the anterior version of our lower limb. This is the posterior version with the plantar foot, so the bottom of the foot, so we can see that. This little M stands for medial. These L's stand for lateral, so we're always oriented, and it's a little bit different for the plantar foot, so I put them down there as well. If you ever get confused, you can always look for those labels. So we're actually going to start posterior. This is our sacrum that I've represented over here. So it's a more medial structure, medial bony structure. If you remember from the other video, and even if you didn't watch the other video, most of the stuff that comes out into the gluteal region actually comes from the pelvis, from that internal true pelvic structures. So they're all coming out through the greater sciatic foramen, which I'm going to dotted line represent for you here. Hopefully you can see that purple dotted line. That is representing greater sciatic foramen. So this structure right here came from the pelvis, started on the sacrum internally, and came out and attached to the femur. This is the key to the butt. This is our piriformis muscle. Remember, I have fever today. This is fever arteries of the lower limb. I'm sweating so much. Lesser sciatic foramen is another hole. Remember, the greater sciatic foramen is just a hole where a lot of things come from the pelvis to the gluteal region. The lesser sciatic foramen is a gateway or a hole between the gluteal region and the perineum. So the perineum, not to be confused with peritoneum, our abdomen, perineum is the area where our genitals exist and the anus exists. So it's that very shallow, thin area below the true pelvis. So the lesser sciatic foramen is a gateway to the perineum, which I'm kind of going to represent here with a little anus, and we would have another structure underneath here. So I'm now going to talk about these two structures. This structure coming from the sacrum and ending at the ischial tuberosity, that's where it attaches more distally, more farther away. This is our sacrotuberous ligament. You just literally combine those two words. I'm going to just write STL so we can remember it. Then deep to the STL, the sacrotuberous ligament, is another ligament from the sacrum, this time to the ischial spine. So instead of calling it sacrotuberous for the ischial tuberosity, we call it the sacrospinous ligament because it attaches to the ischial spine. So sacral spinous ligament, SSL. That's going to get covered up, so it's not really going to matter. But I wanted you to know that the space in between those two ligaments and the hole created by them, the lesser sciatic foramen, which is a gateway from the gluteal region to the perineum. All right. Those are our landmarks to start to understand this area. Now we can actually talk arteries. Now earlier I said the piriformis is the key to the butt. And what did I mean by that? I meant the piriformis helps you orient what is superior gluteal versus what is inferior gluteal in terms of arteries, nerves, and veins. So if you're in lab and you see an artery coming out and branching every which way as they often do, maybe even giving a branch to the piriformis, it doesn't matter. If it's above the piriformis, it's a superior gluteal artery. It's going to run with the superior gluteal nerve. So this is our superior gluteal artery. Awesome. Superior gluteal artery above the piriformis. If you saw a vein up here, if you saw a nerve up here, it's all superior gluteal, and then insert the name of the type of structure. Remember, arteries are real squiggly. They run right next to veins. They got a curve to their shape in terms of like they're cylindrical, versus a nerve very flat, very straight, very narrow. Branches in small V's. Okay, so that's superior gluteal artery. So if you saw an artery coming out right below piriformis, mostly giving blood probably to gluteus maximus, it would be below piriformis, therefore inferior gluteal artery. Remember, we name arteries for where they go, not where they came from. There's so much variation in arteries. You have to have these sort of landmarks to tell what they are. You cannot solely rely on where they came from. Because arteries are what I like to call promiscuous, or generous to be nicer. They are going to give blood to whatever they go by. Superior gluteal artery, inferior gluteal artery, sandwiching our piriformis muscle, coming out of our greater sciatic foramen. There's one more artery coming out of our greater sciatic foramen. Remember, I said it doesn't matter where they come from, it matters where they go. So this artery we're going to name by watching its path, and we're going to follow it. It's going to come out of our greater sciatic foramen, and it's going to look like it's going to stay in the gluteal region, but it's going to dive underneath, so deep to that sacrotuberous ligament, but superficial to, on top of the sacrospinous ligament, which means it's traveling through the lesser sciatic foramen, which means it's going to the perineum. So this is our internal pudendal artery. So that was our internal pudendal artery. It went through the lesser sciatic foramen. It goes under that sacrotuberous ligament. It is supplying the perineum. It will start by giving off an inferior rectal branch, and then it will go from the back to the front, kind of looping underneath from trunk to junk. It loops from trunk, butt, to junk in the front. Gives off some branches. We'll get into that in a different video. So the first three we have are superior gluteal artery, inferior gluteal artery, and our internal pudendal artery, which are all branches of that internal iliac artery from the pelvis. This is what I mean by the greater sciatic foramen is a gateway from the pelvis to the gluteal region. The lesser sciatic foramen is a gateway from the gluteal region to the perineum. One last thing in this area is I want you to just know that a branch of this inferior gluteal artery actually kind of comes down into our posterior thigh, and it's going to connect to another artery that we're going to learn about in a second. So I just want to bring that up so you know that there's sort of a branch here. Okay, that's actually the end. Unlike the nerves, where you have that giant sciatic nerve that then splits and becomes common fibular and tibial nerve in our posterior thigh, arteries-wise, we end right here. And so we're going to have to get all of our other arteries from our anterior thigh. That's where they're going to originate. So let's go to our anterior side, fill in our anterior thigh and our medial thigh, and then we'll join back up and see how these things connect. You may recall from the other video, and if you don't, I'm going to teach it to you now. When you're looking at your femoral triangle, when we're going from essentially our anterior abdomen down into our thigh anteriorly, we look at our structures that exist in that area with an acronym called NAVAL. So I'm going to write it for you. It's N-A-V-L. So it's not spelled like navel with an E, but it is N-A-V-L, navel. Now, N stands for nerve, A stands for artery, V for vein, L for lymphatics. So what we have here is the order in which you'll see from lateral to medial your nerve, artery, vein, and lymphatics that are called femoral. Now, the femoral artery was a continuation of what artery? Remember, your lower limb is right below your pelvis. This is the continuation. Our femoral artery is a continuation of our external iliac. All these gluteal branches came from the internal iliac. All of the femoral branch comes from the external iliac. So does the vein, the external iliac vein. So here's our femoral artery coming in hot. I'm going to put an F for femoral, and then I'm actually going to write it over here because we're going to have to look at some branches now. All right. So femoral artery comes into my anterior thigh. Just so we have a complete picture in our nerve drawing, we saw our femoral nerve that really branches out very, very suddenly here. This would be our femoral vein right next to the artery. And then we would have our lymphatics. So those would be a little harder to see. So let's follow this artery. I just wanted you to see the naval relationship. This artery is actually going to branch almost immediately. It obviously depends on the donor you are working with, whether or not it branches high or low. It's going to depend on that individual's anatomy, but it's going to branch, and the way you're going to find that branch is usually something that you don't think about. A lot of people tell me they can't find their deep femoral branch or their profundi femoris, if you want to use the Latin. So I have these two markers here to show you, and I'll show you dead on and I'll show you from the side. So when you're dissecting, the first thing you're going to see, because they embalm in this spot a lot, is there's probably going to be a damaged vein. That damaged vein can help you find your artery usually. So what's happening here is you see the top of your femoral artery, the continuation of that external iliac. And if you were to lift up your femoral artery, you'll see another artery branching down deeper from it. That's your deep femoral artery. So I'll show you from the side. You can't see the one on the bottom, so you gotta lift up the one on the top, dissect in between here, and you'll start to see the deep femoral artery, which is really important because that's where we're going to find our medial and lateral circumflex femoral arteries, branching from our deep femoral. That's the textbook version. If they branch from your femoral, it's all about where they go. Remember, with arteries, it does not matter where they came from. It's about the journey. Where did they go? Where did they end up? So the textbook, though, is going to say that both circumflex arteries that actually supply the head of the femur are going to come off of our deep femoral artery. So to make the distinction, deep femoral is going to be pink and regular femoral is going to be red. So it's hard to draw in 3D on a 2D whiteboard. So I'm going to draw in our deep femoral first, and then I'm going to kind of dotted line our superficial. Don't you wish it was called superficial femoral? It's just called femoral. So profundi femoris is the Latin. So we're going to see this deeper artery. If we lift up our femoral artery, maybe I'll draw it like this, and then we'll erase so you can kind of see what's going on underneath here. So our deep femoral artery, pink is deep femoral artery. If at this point you're like, I thought it was femoral, it can be whatever you want. Femoral, femoral, femoral. It doesn't matter how you say it as long as you know what I'm talking about. All of these things are relating to the femur, which is the large bone in the thigh. All right, so deep femoral artery branching off here. All right, so this deep femoral is supposed to, it doesn't always, but it's supposed to give off two arteries that are going to branch in complete opposite directions because one goes medial and one goes lateral. So that is how you identify them. If you see a branch going off transversely towards the lateral aspect from our deep femoral up in this area, that's my lateral circumflex femoral artery. If I see it going medial, and I'll tell you the specifics you look for, that's your medial circumflex femoral artery. Remember, circumflex means to go around, so it's telling you what it's doing. It's heading medially, and then it's going around the femur. Lateral is doing that, but in the lateral direction. I am not upset. I am out of breath because I have some sort of illness right now. All right, you can't kill me. It only makes me stronger. So I'm going to draw that, and then I'm going to draw it disappearing between two muscles.
The medial circumflex femoral artery dives between pectineus and iliopsoas. I mess up, I blame the fever, and say adductor longus and pectineus here. But please know it's pectineus and iliopsoas.
This medial circumflex femoral artery, this guy, dives between those two muscles. So that's where it's going to disappear. If you can find them and see an artery disappearing between them, that's where it usually disappears to go deep and around the femur head. So we're going to talk about that in a second. I just want to label it really quick. I'm not going to write the whole thing out because I want you to spell it yourself. Medial circumflex femoral relating to the femur artery. Now this guy, no branches. It's just the medial circumflex femoral, not humeral, femoral artery. The lateral, however, can be identified by the fact that it actually does have branches. Looks kind of like a goose's foot, people say. So let's draw the lateral one in. So the lateral one, the biggest clue, guys, is that this one heads medial and this one heads lateral. And then it's a question of, do I remember what bone is in the thigh? And do I remember the word circumflex? Because it's just all those things stacked on top of each other, making it sound really confusing, even though it's quite explicit about what it is. This lateral circumflex femoral artery is going to have 3 branches, look somewhat like that. So this is our lateral circumflex femoral artery. Let me label you. The lateral circumflex femoral artery is the trunk. Remember, arteries are kind of like trees when they branch. It's just like having tree branches. And it has 3 main branches, A, T, and D. Yes, that was not the alphabet. A stands for ascending, T stands for transverse, and D stands for descending branch. So I'll end in branch. So if I was going to talk about one of these, I would say the descending lateral circumflex femoral branch goes down in the anterior thigh. But these two, A and T, actually are going to anastomose. Remember, anastomosis is where we connect and create collateral blood supply. These are going to anastomose with the medial circumflex femoral artery. So there is an
anastomosis
between these top 2 branches, ascending transverse of our lateral circumflex and our medial circumflex femoral artery around the head of the femur, which we're going to talk about now. So I wanted to take a zoomed in view of this cruciate anastomosis, aka the anastomosis around the femur head and neck. I misspoke earlier because I'm going to blame it on the sickness, but I will tell you what I messed up on. So when we were talking about the 2 muscles that the medial circumflex femoral dives between, it's the iliopsoas and the pectineus muscle, not pectineus and adductor longus. So it's iliopsoas and pectineus that it dives between. And this tendon right here is the tendon of the iliopsoas, or psoas. So that's the attachment point of that tendon to the femur itself. Cool. That being said, and the reason I put this in here is so that you can see where these things are coming from and where they're going. So because I messed up with the muscle and we just talked about, we're going to start with our medial circumflex femoral artery. The medial circumflex femoral artery is going to wrap around. So it's going to come from anterior, go around, and in between iliopsoas and pectineus. And now it's going to become a dotted line for us because what it's actually doing is going behind the femur head. It's underneath this tendon, going back here, and going behind the femur head. Why is that important? It's actually very, 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 very important. There are branches of these, by the way. There's retinacular arteries branch from these arteries. I don't care enough to, you can learn those on your own. Basically, they're going to branch like this way and this way a little bit. Who cares? Maybe some people care. Orthopods definitely care. For this, we don't care. We care that this is the medial circumflex femoral artery coming from anterior, diving behind this iliopsoas tendon. So it is behind it, deep to it, and then behind the actual femur head. And this is super important clinically. And I'm hoping you're starting to piece it together on your own. But we're going to talk about it. If this artery is behind the femur head, posterior to it, and you dislocate this femur head posteriorly, so into the whiteboard, you're going to push directly into that artery, and it is most likely to rupture. So this is the clinical correlate that if you posteriorly dislocate your femur head from your hip, which I've kind of drawn in here, that's our acetabular ligament. If you posteriorly dislocate your femur head, you are most likely to rupture your medial circumflex femoral artery. Why? because it is behind the femur head, and therefore the structure that is at risk if you push back and stretch it out. Arteries don't stretch that way. If you push a bone into them, they're going to rupture. Because I just pointed it out, that this is sort of the socket of our hip, there is an obturator artery about here, and there is a branch of it that goes into that acetabular ligament. This is that acetabular branch
of the obturator artery. So I want to pause here to explain why I brought up this artery, since I don't during the normal recording. The ligament of the femur head, sometimes called round ligament or ligamentum teres, yes, exactly like the liver, I'm so sorry you have to learn all these, connects the head of the femur to the acetabulum, which is the hip socket where the joint occurs, where it articulates. If you dislocate your hip, aka your femur head, the artery, which is a branch of the obturator artery you learned about in the pelvis, or will learn about in the medial thigh, is at risk of injury always in a dislocation. To physically dislocate, it kind of requires damage to the ligament of the femur head, and therefore that artery is at risk too. And this can become problematic during exam questions, because if your professor lifts both the acetabular branch and the medial circumflex femoral artery as answer options to a multiple choice question about a posterior hip dislocation, you have to pick between the two, which is more likely to be ruptured. Now, typically they're going for that medial circumflex femoral artery, but if both are there, both could be argued as correct.
So if medial circumflex femoral is behind the femur head, posterior to it, where is lateral? Well, lateral is anterior. And lateral, I'm going to draw right in about here. Remember, it's anterior. They branched off the same artery originally. It's orange, lateral circumflex femoral, in this demonstration. It's going to have an ascending branch and a transverse branch, right? So we have this ascending branch of our lateral circumflex femoral artery, which I said LCF, and we have a transverse branch of our lateral circumflex femoral artery. We also have a descending branch, but I'm going to show you why it's not involved in this, because it literally goes down along the femur. We don't care. These guys, however, are going to wrap around the femur head and connect themselves to these arteries. So this is not exactly how they connect. I'd like to make that clear. And there might be more branches, like there might be another branch over here from your medial circumflex femoral artery on the posterior side. But the point of this is, just in case you can't read that scribble, lateral circumflex femoral arteries, ascending and transverse branches, and the medial circumflex femoral artery, anastomose around the head of the femur. The acetabular branch of the obturator artery is also involved in this anastomosis. On the posterior aspect, it is mostly medial circumflex femoral artery branches. So if you posteriorly dislocate your hip, they call it, but it's really the femur coming out of the hip socket, you'll probably rupture your acetabular branch if this rips, but you'll also put very much at risk this medial circumflex femoral artery with a posterior, this is like a star, posterior hip dislocation. If they put acetabular and this, I'm sorry. You'll have to tell me which one they accepted, because you could definitely argue acetabular if you posteriorly dislocate your hip. If, however, anterior dislocate your hip, we're talking ascending, transverse, and acetabular arteries. So an anterior hip dislocation, very uncommon, would be with our lateral femoral circumflex artery because it's anterior to the femur head. Remember, I messed up earlier. I like to tell you when I mess up because I want you to know the truth. Iliopsoas and pectineus are two muscles right next to each other in that femoral triangle. They make up the floor. So here's pectineus. Here's iliopsoas. If anybody remembers, posterior abdominal wall, we had the iliacus and the psoas muscle. They come together to form the iliopsoas. So this is iliopsoas, and this is pectineus. Iliopsoas and pectineus are right next to each other. The medial circumflex femoral artery comes off of the deep femoral and is going to literally dive in between these muscles. So that's the relationship I need you to know. All right, now that we understand the anastomosis of our femur head called the cruciate anastomosis. We are now going to talk about that regular old femoral artery. I'm going to draw right on top of this so we can actually see it, because it would be more visible than this deep femoral artery. They would branch away from each other. Nice. So this femoral artery, this guy, is much more superficial. Deep femoral is, in fact, deep. Now, I said we were done, but I'm going to connect this now.
Now, I'm about to tell you about the deep femoral artery and its connection to the inferior gluteal artery and how it supplies the posterior thigh muscles with blood. What I forget to say is that the medial circumflex femoral also often connects to the inferior gluteal artery, forming an anastomosis. So I wanted to just mention that here since I don't in the original recording.
Deep femoral doesn't just disappear. Deep femoral helps to create an anastomosis and connect to our inferior gluteal artery and supply our hamstrings with blood. So our deep femoral artery, which is going to disappear in our drawing over here, actually ends up diving deep and supplying our posterior, thigh muscles, so our hamstrings. And it's going to anastomose with our inferior gluteal artery. I'm going to label it here. This is our deep femoral. Because a lot of times in these pictures, you don't see this, or it's not talked about. And then you get a question about what supplies that area and no one knows. So it is actually the deep femoral and the inferior gluteal artery working together. But it stops. Notice how it stops. We're done. Just this upper hamstrings portion. And I will show you why that's true. Femoral artery, it's going to run like this in the same direction as that sartorius muscle we talked about last time. It's like a sash across your anterior thigh from lateral to medial. Sartorius. So this is our femoral artery, and notice our femoral artery suddenly disappears on one side. When something suddenly disappears in anatomy on one side, it's usually because it's showing up on the other side, the opposite surface. And this is true here. And this one is traveling in a very specific hole. It's going to go through a very specific tunnel, I'll call it, or opening. This hole is in our adductor magnus. It is in between our hamstrings portion and our adductor portion. And so this hole is called the adductor hiatus. So through our adductor hiatus is actually where our femoral artery goes. And it ends up right here in the back of the knee that we call the popliteal fossa. So femoral artery supplying our anterior thigh muscles ends up in the popliteal fossa. Femoral artery is going to do a name change once it goes through this adductor hiatus. It was femoral artery, but when we pass through the adductor hiatus, we become known as the popliteal artery, or popliteal, however you want to say it. It's the same word, it's just pronounced differently by different people. This is my popliteal artery, which is actually just a continuation of my femoral artery, which is actually just a continuation of my external iliac artery. Everything is related. Popliteal goes through the back of the knee area called the popliteal fossa. And this back of the knee is actually going to be where we have these branches that come off above the knee joint and below the knee joint.
And one from the middle that my fever brain didn't mention, and then I'll add into our picture as we go. Hint, it has middle in the name.
That supply the knee joint with blood. So here's our anastomosis around our knee. And our knee is also called genu. Genu is the Latin word for knee. So genu equals knee. So arteries that supply the knee are going to have genu in the name, and they're actually going to be called geniculate arteries. Geniculate will be in the name of every single one of these arteries because they go around the knee. Now we're going to talk location. Remember, this is medial and this is lateral. So these two are both lateral, for sure. They have lateral in the name. These two have medial in the name. The top two have superior in the name. The bottom two have inferior in the name. So this is above this one. This is above the knee. This is superior. And this one is superior. These two, however, are inferior, right? Makes sense. So we got a superior medial, we got a superior lateral, we got an inferior medial and an inferior lateral, and now all we have to do is add the word geniculate, or genicular. Long name for a very small artery. I'm just going to write genu for these other ones because it's just too hard to write it all. And you know what I'm trying to say.
And here's the point at which, again, I'm going to point out the middle geniculate artery coming from the middle. It's a single middle branch that will also contribute to this anastomosis. It's really difficult and unnecessary to see this branch in the lab.
So what happens to these arteries, I said earlier, is that they anastomose around the knee joint. So they're going to come around here and essentially form this sort of anastomosis and connect to one another. It won't necessarily look like that, but it looks something like that. And these are all your geniculates forming your genicular anastomosis. Cool. Now, weird thing is we left this area and now we're on the back side and there's nothing on the front side to supply it. So all of our front-sided leg arteries are actually going to come from here. And we're going to see that happen in just a second. Before we go down into the leg, I want to actually address some of the things that I forgot to mention up in our anterior thigh region because we need to make some connections and we need to make them now. So femoral artery, I would categorize as anterior thigh. I want you to relate those two arteries. Now, deep femoral artery is also anterior thigh, but it kind of is a branch of femoral. So yes, it is there as well. But when we think of anterior thigh, we're going to think of these vessels. Medial thigh, our adductors mainly, are going to be supplied by a different artery. Now that different artery comes from the pelvis, just like our other arteries we talked about before. Our gluteal arteries are going to come from the pelvis because lower limbs are attached to it. It makes sense. But it's going to come out of a hole in the bone. So our bony pelvis has a hole on the front side. I can just draw a very quick pelvis for us right here. We really only need the front part, but I am going to do the whole thing because I'm nuts. Woohoo! All right, we got a little pelvis here. And I want to point out some stuff on our little pelvis. We talked about our greater and lesser sciatic foramen before. I'm not going to be able to show them to you from this angle because this is an anterior view of the pelvis. This is our pubis, our pubic symphysis, a little bit of our ischium, and then our ilium up here, the wings, and that's our sacrum in the back. So the hole I want you to look at right now is this one right here. This is our obturator foramen. Our obturator foramen is mostly covered by a membrane called an obturator membrane. So the majority of it is covered by this membrane. But there is a little hole in the membrane that allows for an artery, nerve, and vein to pass through from the pelvis out into, you guessed it, the medial thigh. So our artery, our obturator artery, is going to head out through the obturator canal with our obturator nerve and our obturator vein. So this is that obturator artery, and it's going to go straight into the medial thigh. So coming out of the canal is our obturator artery. It's going to give blood to our medial thigh muscles. It is also going to give off a branch that goes to that ligament that connects the head of the femur to the socket itself. The obturator artery gives off an acetabular artery. This is where it comes from. So I just wanted to mention that because it's a branch that people sometimes forget about. This is our obturator artery coming out of our obturator canal, which is a hole in our obturator membrane, which is a membrane that covers the larger hole that is our obturator foramen. So those are three different things, very closely related. There's our obturator artery and then our acetabular branch to the head of the femur, which you saw earlier. So now we can associate femoral and deep femoral and the branches that come off of it with the anterior thigh, obturator artery with our medial thigh. Our posterior thigh is kind of associated as well with our deep femoral and our inferior gluteal. So kind of a combo. This is our posterior thigh. Our gluteal region has several different arteries. One is above, one is below the piriformis, superior gluteal, inferior gluteal. Those are going to cover our gluteal muscles, as well as our little guys that are in there, like our gemellis. Then we're going to have in the perineum, the internal pudendal artery that's going to branch from trunk to junk, from back to front. And then we are going to start up where I left off before with our popliteal artery, which gave off our knee arteries called our geniculates or geniculars, it depends who you talk to, that are going to wrap around the knee joint and supply it. Now, popliteal is going to leave the popliteal fossa, which is the back of the knee, the armpit of your knee, or of your leg, you could say. And it's going to enter into what we call the posterior leg. Now, I have a video about the compartments of the leg. If you're interested in it, I'll link it up here, or watch it after this video. It will walk you through the different 3 compartments of the leg, the posterior, the lateral, and the anterior, and which arteries and which nerves are grouped together, as well as sort of the functions of the muscles in those different areas. It's a good video. Helps people compartmentalize the leg. Popliteal artery has changed name from femoral, has changed name from internal iliac. When popliteal artery exits the popliteal fossa, it is also going to change name. Now, we're going to see a branch come off, and that's going to be our indicator that it has changed name. So, popliteal artery comes into our posterior leg and is going to branch twice. So I'm going to draw the full thing. We're going to talk about all of these branches. This one disappears. So I drew them in, and now we're going to talk about each one. First one we see disappears. What does that mean? It means it shows up here. When it disappears, it shows up here. So this is headed to the anterior surface. This is our anterior tibial artery. The leg, the arteries are named for where they are. The nerves are not always named for where they are. So you need to remember, arteries are going to be the logically named ones. The nerve names make sense, but they are going to get a little confusing. And because of that, I'm always going to, in green, put the nerve that runs with the artery next to it. So our anterior tibial artery that we're going to see in the anterior leg runs with, this is where it gets confusing, the deep fibular nerve. Anterior tibial artery and deep fibular nerve run together in the anterior leg. So let's follow that artery. Anterior tibial artery is going to show up in the anterior aspect of the leg. But remember, in our anterior leg, we actually have a lot of bone, a lot of tibia. And tibia is going to be a more medial structure. So our muscles are kind of over here on the lateral aspect, because this is all bone. What do we have? We have an anterior compartment that's going to have an anterior tibial artery in it. And this anterior tibial artery is going to come out right about here in those anterior muscles. And then it's going to go out onto the foot. And we're going to talk about the dorsum of the foot, the top of the foot, in a second. I'm going to stop here for now so we can finish this picture. But this is our anterior tibial artery. Makes sense when you realize how close it is to the tibia. So the bone over here, more lateral in our leg, would be our fibula. And we're going to look at this next branch and talk about which branch this is. Kind of gave it away by saying that. But this branch is going to be our fibular artery, artery. And you can probably guess that's going to run with a fibular nerve, not the deep one, but the superficial fibular nerve. So again, anterior tibial artery is with the deep fibular nerve, whereas fibular artery runs with the superficial fibular nerve. So sup fib nerve. And I'm going to draw it or write it on the anterior side because it's easier to do. The fibular artery supplies the lateral compartment of our leg, and the lateral compartment is kind of on the side of our anterior compartment, so it's over next to the fibula. So we're going to see our fibular artery just kind of very small in these muscles in our lateral compartment, which are all fibular muscles, the fibularis longus and the fibularis brevis. So this fibular artery has another name from days of old. So some of you are going to have to know both names. even maybe all of you are going to have to know both names because it used to be called the peroneal artery. So peroneal is another word for fibular. So anytime I've written fibular, you could replace that with peroneal. So I'll do a whole thing with it. This would be the anterior tibial artery running with the deep peroneal nerve. This would be the peroneal artery running with the superficial peroneal nerve. So peroneal is something you're going to hear from some medical professionals that went to school a while ago because there was a name change. And every time there's a name change, it just means there's another word added to your list because you kind of have to know them all. So peroneal, I'm going to put it on there so we realize what that is. It's just another word for fibular. Today's term is fibular because it makes more logical sense. And it doesn't sound like perineum and peritoneum and peroneus. They're all so similar. It was a good change, I think. Fibular artery runs with superficial fibular or peroneal nerve so that we get those down together. So what the heck is this one then? The leftover. Well, I said they're named for where they go, and you'll notice anterior tibial goes to the anterior surface. Fibular goes to the lateral aspect where the fibula is. So this artery, after this anterior tibial branches off, is known as, this part and this part, all the way around our medial malleolus, is our posterior tibial artery. Posterior tibial artery runs with tibial nerve. All right. Posterior tibial artery. After anterior tibial breaks off, this is no longer popliteal. This is now posterior tibial artery, and then fibular is going to branch off, go to the lateral compartment. Anterior went to the anterior compartment of the leg. Posterior tibial supplies the posterior compartments of the leg because there's a deep and a superficial. This artery is found under the superficial muscles. So what are my superficial muscles of my posterior leg? They're going to be my plantaris, the little one, the freshman nerve, we call its tendon, the soleus, the big one, the powerhouse, and the gastrocnemius. So those three together all come together at a common tendon called our calcaneal tendon, which is our Achilles tendon. Those are our three superficial posterior leg muscles. This artery, this artery, this artery will only be found once you reflect those superficial muscles because they're going to be sandwiched in between the superficial on top and the deep muscles of that compartment underneath. Posterior tibial goes around this bony structure. That's our ankle right there. This is the medial aspect. So this is our medial malleolus. The bump. It's a bone, but it's the bump on the side of our, what we call our ankles. This would also be our medial malleolus right here. But on the posterior surface, I want you to see how this is wrapping around the medial malleolus. So that's interesting. Where does it go? Disappears from our picture. Doesn't actually show up here. Medial malleolus structures, so everything that goes around the medial malleolus is actually going to end up on the plantar surface of the foot. That's a good thing to know. So medial malleolus, this is also the medial malleolus. I'm going to put MM. This would be the lateral malleolus on the opposite side. Anything that goes around the medial malleolus ends up on the plantar surface of the foot. So let's take a look at that. We went around it. We end up plantar surface of the foot. So this is our posterior tibial artery, goes around the medial malleolus, ends up on the plantar surface of the foot, and then splits into two arteries, one that heads more lateral and one that heads more medial. And they're going to branch for sure, and we're actually going to look at those specific branches, but I just want to get their main names down first. So our posterior tibial artery splits into two, and they are named for where they are. These are our lateral and medial plantar arteries. So, based on where they are, they're on the plantar surface of the foot. This is medial, this is lateral, this is a medial plantar artery, this is the lateral plantar artery. They run with the nerves that have the exact same name, medial plantar nerve, lateral plantar nerve. Pretty simple. So that's what happens to posterior tibial artery. The plantar surface of the foot has blood. What about the dorsal surface? So our fibular artery stops in the fibular or lateral compartment, but the anterior tibial artery goes onto the top of the foot. There's a couple very important arteries that you need to know about up here. The first of which is that when our tarsals begin, the small cuboid bones of our foot, our tarsals, we're going to have two tarsal branches, a medial and a lateral tarsal branch. So this would be our medial, because of medial, big toe, and lateral tarsal branches. So medial or artery. They're not the most important, but they're important for a very important distinction. That's a weird sentence, but I'll make it make sense. When you see these arteries come off of my anterior tibial artery, this is no longer the anterior tibial artery. This is a different artery called the dorsalis pedis or dorsalis pedis, however you want to pronounce it. It means dorsal foot artery. Makes sense, right? The Latin name for this makes a lot of sense. The artery on the top of your foot, the dorsum of your foot, is called the dorsalis pedis artery because it's on the dorsum of the foot. The very literal change happens when the tarsal arteries come off. But most people, when you're tagging it in lab, all you really have to look for is it in the leg proper or have we crossed the ankle joint? And they're tagging the artery below the ankle joint that's on top of the foot. That's probably the dorsalis pedis artery, versus if it's up in the muscles, up in our leg, that's going to be my anterior tibial artery. Most people, when they tag exams, are not going to tag right in the middle because then it becomes sort of a subjective answer, since unless you can see those tarsal arteries distinctly dissected out, you really can't tell if it's tagged right here which one it is. Now, here's a cool relationship. I didn't learn this when I was in school in my master's program, but it makes so much more sense when you connect these things together. So you're going to see a branch come off of our dorsalis pedis, and that branch is actually going to create an anastomosis that arcs with our lateral tarsal artery. And this arc is aptly called the arcuate artery. Arcuate artery. Cool, right? So a branch of the dorsalis pedis is called the arcuate artery that makes an arc over our metatarsals mainly, that is going to be connected to our lateral tarsal artery. Cool relationship. If you think about what this is supplying, like I said, it's supplying the metatarsals, those longer bones in your foot. The metatarsals are pretty deep, so getting to this artery means you have to dissect quite a lot. There's a lot of tendons in this area. It might be hard to see that artery. You might just see a little blip of it coming off. That's the first artery that branches off of our dorsalis pedis. Off of our arcuate artery, we're actually going to get those branches of those digital arteries coming off of here and going into the toes. So the next branch, I'm going to draw it like this because it disappears into a hole. It goes deep. If it goes deep from the top of the foot, it ends up on the bottom of the foot. And this is called our plantar arch that we're going to create with this little branch. It's going to connect to our plantar arteries that are looping, just like we're arcuate arteries looping. We have another anastomosis sort of arch in the bottom of our foot. One on the top of our foot, one on the bottom of our foot. So basically, these are going to branch into your digits. They're just really called digital arteries, but they connect to the plantar arch. So I'm going to show you that. The main feature I want you to get out of this is that all of these arteries in the foot, bottom and top, are connected to one another. A lot of anastomosis going on. So let's check back in over here with our plantar arteries. Okay, so off of specifically our lateral plantar artery is where we get this plantar arch. And there is a branch of our medial plantar artery that meets up with it, but the main one that gives off this plantar arch is going to be our lateral plantar artery. Think of the lateral plantar artery like the ulnar artery that gives off the main arch in your hand. This is similar but different. So this would be, I'm going to draw an arrow to it, the plantar arch. And our plantar arch is going to connect to our dorsalis pedis artery. That's actually what we're seeing here to here. So out of nowhere, you're going to have this dorsalis pedis part that comes in and actually connects to the plantar arch. So the dorsalis pedis, it will anastomose and connect to our plantar arch and the bottom of our foot. So let's go through it one more time. I do want you to know that these are also going to branch off into those common plantar digital arteries, proper plantar digital arteries. All this stuff is coming off of here to the toes, to the digits, and supplying the muscles and all that jazz. So let's back it up, go through the foot one more time, because I know it's a little confusing. Anterior tibial artery in the anterior leg comes down, gives off a lateral tarsal artery and a medial tarsal artery. No one cares about the medial tarsal artery. Lateral, however, is going to anastomose with the arcuate artery, and the arcuate artery is a branch of the dorsalis pedis. So when tarsal arteries come off, or when we cross the ankle joint, the anterior tibial artery becomes the dorsalis pedis artery because it is on the dorsum of the foot, the dorsal foot artery. Dorsalis pedis gives off arcuate artery that connects to lateral tarsal. Anastomosis gives off some digital arteries on the dorsum of our foot. And then we have this branch that's actually connecting to the deep plantar arch. This is our dorsalis pedis connection between dorsal artery to deep plantar artery. So on the bottom of the foot, the plantar surface of the foot, we have our posterior tibial artery coming around the medial malleolus into the bottom of the foot. It's then splitting into two arteries, the medial plantar and the lateral plantar artery. The medial plantar mainly stays superficial and medial. The lateral plantar gives off the deep plantar arch, and that deep plantar arch, like we just talked about, connects to our dorsalis pedis. The deep plantar arch is going to give off common plantar digital arteries and proper plantar digital arteries. And remember, common is just before they split and go into the specific toes. My way of remembering that, they test this way less in the feet. It's mostly tested in the hands. But the way I remember the difference between common and proper is you see PDA, like you see it. You see someone doing PDA and you're like, whoa. And then you perform PDA later in life. Maybe, I don't know. That's how I remember it. For common plantar digital artery versus proper plantar digital artery. Proper is more specific. You see PDA before you perform PDA. And that is the entirety of the arteries of your lower limb that you need to know about.
Thanks for watching. Like, share, and most of all, subscribe. Toodaloo.